Hello, everyone. My name is Nicole McCallister, and I'm one of the social workers here at Ironwood Cancer and Research Centers. And today I'm going to take you to the beach. We're going to take this trip via guided imagery. So I put my favorite beach hat on, my glasses on. You don't have to wear sunscreen for this trip because it's all virtual. But I am going to get you to experience the sand beneath your toes, the sun on your face, the wind through your hair, and the smell of the sea. The beach is one of my happy places, and we'll talk about how you could choose any place that is happy to you. And there's hundreds, if not thousands, of examples of guided imagery scripts on YouTube. You just need to make sure that you pick one that is ad-free. So halfway through your calming, peaceful guided imagery script, you're not hearing an ad for shampoo or a paw cleaner for your dog. So just a brief little history on guided imagery. It's a great tool to create harmony between the body and mind. It's focused relaxation that allows your imagination to create a calm, peaceful image in your mind. It's a mental escape from the real present. It involves all of the senses, body, and emotions. It's a very useful coping skill and way to find inner strength, courage, and hope. 3 things we always want for you here at Ironwood. Guided imagery has been around for centuries. It's a technique that involves the deliberate use of the power of imagination to recreate one's own mental images, sounds, smells, and even tastes to reduce anxiety and to promote mind-body healing. It can be learned from books or self-help tapes or from a licensed practitioner. Good opportunities to use guided imagery include PET scans, MRIs, CT scans. I know personally for me, I don't do well in the MRI, CT scans. I didn't know it until I had one recently. And as soon as I got in and they were starting, I panicked. I opened my eyes and it was just not the most pleasant experience. So I restarted and said, I'm going to do guided imagery and I'm going to go to my favorite place, my happy place. I'm not going to be here in this MRI machine, and it totally works. You can also use it during radiation treatments if you have a hard time getting up on the table and being in that room for your treatment. You can use it while you're getting chemotherapy in the infusion center. You can use it at home for a medical procedure. Maybe you're getting a biopsy done and you're just feeling a little stress and anxiety over it. This will help calm you. It'll help relax you. It'll help take you away from where you're at that moment and kind of have that escape. It's also really good for dental appointments. There's a lot of people out there that are afraid of the dentist and have that fear. And so guided imagery can help you get through. And that's really what we want you to accomplish using guided imagery, is to help you get through so that it doesn't seem so scary. It doesn't stress you out. It doesn't cause that anxiety, whatever it may be. The one piece of advice I have for you in using this in like a medical setting or in a place where there's people around is to tell the practitioner or tell your radiation therapist that you're going to be doing guided imagery. And so you're going to kind of tune out everything in the world. And so if they have a question for you and they need you to respond, they should tap on your arm and say, Nicole, I need to ask you a question because I'm going to be in my zone. I'm going to be out on the beach and I'm going to be listening to the waves and not paying attention to what's going on in front of me. This was a great quote that I saw when I was doing research for this. It says, the quieter you become, the more you can hear. And I think that's often so true. Some of the physical benefits that came out of the research of guided imagery include regulated heart rate. If you ever get stressed out and anxious and you feel like your heart's going to pound right out of your chest, it can slow your heart rate. It can kind of reduce that and regulate it and make it a normal heart rate. It can lower your blood pressure, improve respiratory function, decrease pain or the awareness of pain. It can create that balance between mind, body, and spirit, reduce fatigue, symptoms of depression, and it helps bring about that state of mind and body most conducive for healing, which is deep relaxation and positive focus. Anxiety can be lessened or even eliminated. And anxiety is something a lot of us experience, whether we talk about it or not. But anxiety can affect pain, prolong recovery time, and even lower our immune system. It's also very good for CINV, diminished chemotherapy-induced nausea, vomiting. CINV is the chemotherapy-induced nausea and vomiting, but it can reduce that, it can eliminate that. And we're going to talk specifically about the research and what it says for cancer patients. There was a study of breast cancer survivors. Both live delivery and telemedicine offered interventions of guided imagery reported reduced fatigue, cognitive dysfunction, kind of that scatterbrained chemo brain, and sleep disturbance. So people were able to sleep better. They felt more energy, and they felt like they were thinking more clearly. Decreased anxiety, depression, and body discomfort in gynecologic and breast cancer patients undergoing radiation therapy, as well as reduced stress and fatigue in patients undergoing treatment for thyroid cancer. Practicing guided imagery before surgery was shown to improve mood in prostate cancer patients undergoing radical prostatectomy. Research suggests that it's also effective in reducing shortness of breath in advanced cancer patients and in decreasing that CINV, chemotherapy-induced nausea and vomiting. So how does it work? In a typical session, the instructor helps foster a state of deep relaxation via breathing techniques, music, or progressive muscle relaxation in a quiet environment. Guidance is given to enable one's own imagination to help relieve symptoms. Visualization exercises involving holding in mind images that bring about healing. Repeating these exercises results in a conditioning effect that empowers a patient to use them whenever needed. An important aspect of guided imagery is the regularity with which it is practiced and not the amount of time spent at each session. So what does that mean? It means you don't have to do a guided imagery script that lasts 30 minutes in order to feel relief. It also means that one session isn't necessarily going to cause you to have, relief from it. It's something you practice. The old saying, practice makes perfect. Well, there's not one fix for everyone, but we do look at the research, and there's a lot of patients who've experienced relief from guided imagery. And this is something you could use even if you don't have cancer. So practice, and you can be short sessions, 5 minutes, 10 minutes. It does not, again, have to be like an hour-long session in order to get that deep relaxation. Today's session is going to be very brief, but I think you will find some benefit if you practice and you tailor it to your own images that bring about healing, peace, and that happy place. Before we start the demonstration, I just want to remind everyone that Supportive Care Services at Ironwood is here for you. And you can reach us by emailing socialwork@ironwoodcrc.com. You can call us at 480-314-6660. The social workers at Ironwood are myself and Jessica Wells. Jessica covers our East Valley offices, and I do the West. Emily Wolf is the medical assistant to Dr. Rula, but she's also our team guru and just keeps us all in check and on track with everything that we do. We love her. Dr. Rula is our integrative medicine doctor. A lot of people have had interactions with her, and she's participated in a lot of speaking engagements. You can find a ton of her videos here on YouTube. And then we have two amazing registered dietitians, Kendra Peterson in the West Valley and Brenda Gridley in the East Valley. So, time to go to the beach. So I need everyone to sit back, get comfortable, and silence your cell phones. So you're going to make sure they're turned off. We don't want any interruptions. So make sure you're in that quiet place. If you are sitting, you're going to make sure that you have like a pillow or something to support your back. And if possible, keep your feet flat on the ground, your arms in a loose and limber position. If you do need to lay down to do this, I advise you don't do it on a bed unless it's a supportive bed. We don't want you to do this to fall asleep. We want you to do this because you're going to relax from head to toe. And remember, you could be doing this in an infusion chair or the radiation table. It's just a place where you can move and wiggle a little bit in the beginning and then find that deep relaxation. So I will give everyone a second, pause if you have to, and then we're gonna go to the beach. So get comfortable, find that supportive, comfortable chair or lie on your back. Let's begin by relaxing your body and releasing all areas of tension. Allow your arms to go limp and then your legs. Give each arm a little shake to relax the muscles. Feel your arms and legs becoming loose and relaxed. Now relax your neck and back by relaxing your spine. Release the hold of your muscles all the way from your head, down your neck, along each vertebrae to the tip of your spine. Rotate your head in a circle, first clockwise, then again counterclockwise. Repeat this until you feel all of that pressure out of your head, neck, and spine. Now I want you to breathe deeply from your diaphragm. Draw in air fully into your lungs and release the air through your mouth with a whooshing sound. Breathe in again, slowly. Pause for a moment. Hold your breath. And then breathe out. Draw a deep breath in and out. In and out. Become more and more relaxed with each breath. Feel your body releasing all of the tension, becoming relaxed and calm and at peace. Feel a wave of relaxation flow from the soles of your feet to your ankles, lower legs, hips, pelvic area, abdomen, chest, back, hands, lower arms, your elbows, your upper arms. Feel that relaxation in your shoulders, in your neck. Concentrate on relaxing the back of your head, even your face. Relax your face. And then at the very top of your head, let it all go. Allow your entire body to rest heavily on the surface where you sit or lie down. Breathe in, breathe out. Breathe in, breathe out. Now that your body is fully relaxed, allow the visualization, relaxation to begin. Imagine you are walking towards the ocean. You are walking through a beautiful tropical forest. Hear the sounds of the wind blowing through the palm trees. You can hear the waves up ahead. You can smell the ocean spray. Feel the air. The air is moist and warm. Feel a pleasant, cool breeze blowing through the trees. Stand there and just enjoy the breeze. Imagine walking along a path as you come closer to the sea. As you come to the edge of the trees, you see the brilliant aqua color of the ocean ahead. Stand there for a moment and take in the beautiful color of the water. It's a bright aqua with dark patches of blue where the water deepens and light patches where the sandbars attempt to break the surface. If you look closely, you can even see the white caps on the waves as the wind catches the sea or the tide. Step out onto a long stretch of white sand. The sand is very soft powder. Imagine taking off your shoes and walking through the warm, white sand towards the edge of the water. Feel the sand between your toes. Allow yourself to sink gently into the earth as you walk along the beach. The beach is wide and long. It stretches as far as you can see to the right and to the left. Take a moment to look both ways and enjoy the peace and serenity the ocean brings to you. Hear the waves crashing to the shore. Smell the clean salt water and beach. You gaze again towards the water. It is so bright blue and green. Enjoy the colors. Enjoy the sounds. See the waves washing up onto the sand and receding back towards the ocean, flowing in and out, in and out. Try to breathe and match the tide, in and out, in and out. Enjoy the ever-repeating rhythm of the waves. Imagine walking towards the water over the fine, soft sand. Allow yourself a moment to stand on the beach. Close your eyes and raise your face to the sun. Feel the warmth come over your face and your body. Let the warmth of the sun connect with each of your joints. Stretch your arms up to the sky. As you step into the edge of the water, you can feel the mist from the ocean on your skin. As you walk closer to the waves, feel the sand becoming wet and firm. A wave crashes over the sand towards you and touches your toes before the wave returns to the sea. As you step forward, more waves wash over your feet. Feel the cool water provide relief from the heat. Walk further into the clear, cool water. You can see the white sand under the water. The water is a pleasant, relaxing temperature, but provides relief from the heat of the sun. Take a moment to enjoy the sea as you wish. Maybe you choose to walk further and deeper into the water. Maybe you want to take a quick swim. You may even choose to sit on the edge of the tide and just feel and watch the water crash into you. Whatever you choose, enjoy the ocean for a few minutes. Allow yourself to become more and more relaxed. There is no pain, no stress, no worries. There is only the sound of the ocean, the smell of the sea, and the feel of the water and sand. Breathe in, breathe out, breathe in, breathe out. Now you are feeling calm and refreshed. You walk back out of the water and onto the beach. Up ahead is a comfortable lounge chair and towel just for you. You can choose to sit or lie down in the chair or spread the towel out on the sand. Spend time relaxing, stretching your body, enjoying the sun, the breeze, and connect with the sound of the waves. Enjoy a refreshing glass of coconut water and a few bites of fresh melon. Smell the hint of hibiscus flower carried through the breeze from the trees nearby. Hear the sound of a gull flying overhead. Listen for the moment the waves crash up onto the beach. The tide is rhythmic. You feel peaceful and relaxed. Allow all your stresses to melt away. Use the heat of the sun to melt all your worries away. Breathe in, breathe out. Breathe in, breathe out. When you are ready to return from your vacation, do so slowly. Do not open your eyes right away. Slowly move your fingers, stretch out your arms, rotate your feet at the ankle, and begin to move your legs slowly. Bring yourself back to your state of being alert and aware. Always remember that feeling of calm and relaxation you found at the beach. Open your eyes and become fully alert and feel refreshed. We hope you enjoyed this demonstration today. And again, this was just a brief example. I suggest reaching out to one of your social workers or checking on YouTube to find a good guided imagery that will help you. But again, spend some time thinking about what makes you happy. What vacation have you taken that's just made you feel so relaxed and at peace? Or is it a family home or vacation spot? Maybe a cabin up north? Pull out some pictures in advance of a place if it's familiar to you, and just scan those pictures and let those images just set in your mind. So when it's time to do your relaxation, it's fresh in your memory and you can connect with the buildings, the places, the animals, the smells, the sounds, everything about that place, and really escape to help you get through what you're going through now. Take care, everyone.